Now that you've had surgery, let's talk about all the things that you'll need to know for going home in your post-operative care. Everything that we cover here is also provided in the written materials that we send home with you. So now we're going to talk about going home and how do you care for your incision. So when you go home, we've just now removed that bandage. You're never going to touch your incision. In fact, we never really want you to touch, pick, poke, or put anything on that incision, and that includes cleaning with any kind of peroxide, lotions, ointments, Neosporin, vitamin E, just keeping the area nice and clean and dry. You will need to change your bandage every day, and mostly we just want you looking at that incision just to monitor for any signs of infection. What does an infection look like? If the area becomes very red, hot, swollen, oozing any kind of pus, green stuff, or has a foul smell, or if you had a fever, anything over 101, then you would need to call your surgeon right away and let them know. They would be able to determine whether that's an infection and start treatment right away. So for right now, we'll just go ahead and cover your incision with the bandage. You will be sent home with a dressing kit, and it includes the very same things that we'll use here and what we've used here in the hospital. It's just gauze, it's a 4-inch by 4-inch gauze, some Metapore tape, and some hand sanitizer, as well as full instructions of everything that we're covering here today. So I will go ahead and use, again, the same gauze and tape. So I'm going to go ahead and open up my packagings. I should also say that I've already washed my hands. When you're home, you will need to wash your hands either with the hand sanitizer that's included or soap and water, whichever is your preference, as long as you're washing with something, okay? I'm going to go ahead and open up my packaging. I'm being very careful so that I'm not actually touching the gauze, and then I'm just going to lay it down and have it ready to go. So 2 packages should be enough. And then I'm going to go ahead and get my tape, and I'm going to tear off a few strips and have these ready to go. Again, this tape is nice because it's perforated, and I'm just going to tack it to the side of the table, chair, wherever you're at. You can just stick it. So 3 strips here, and you'll become an expert at ripping tape. So there's my tape. Okay, so nice bare incision, and all I'm going to do is just cover that incision with the gauze. I'm picking up the gauze, I'm not touching the side that's going against the incision, so that's still clean. All I do is just lay that right over the incision, maybe overlap just a touch, and that's it. At this point, I'm just going to tape it down. With the tape, I'm just being very careful that as I tape, I'm just going to lay it on there and fan it down. I'm not putting any extra tension on the side of the tape, so here I'm not going to tack it down and pull on that. I'm just going to lay it nice and loose, and then the same thing for the top one, and tack it down. Again, the bandage does not have to be perfect or beautiful, it just needs to stay covered, okay? So when you run out of this Metapore tape, and you most likely will, all you need to go out and purchase, if you haven't already, is just some 1-inch, whatever kind of tape. You can find drugstore, grocery store, doesn't really matter unless you have some kind of a tape sensitivity or allergy. At that point in time with the 1-inch tape, when you go to tape your bandage down, all you're gonna do are take strips, and you're just gonna tape around the borders of the bandage here. So all the way around each side, and then maybe one in the middle to connect the two, and that's it. You're not going to take your tape and completely cover this, because this tape will trap in heat and moisture. The Metapore is nice because, like I said, it has that venting ability, so it can get some airflow and allow that incision to breathe. So with this tape, all you're going to be doing are perimeters around the edges, and then maybe one to connect the two, and that's it. Now, like I said, you're going to do this every day. You will also need to keep your incision kept dry when you shower, and you are allowed to shower, but you will need to wrap it. And hopefully you've gone out and purchased your Glad Press and Seal. This is a fabulous product to keep your incision nice and dry. So what you'll want to do when you shower, you'll go ahead and you'll leave your incision covered with the gauze bandage. You're going to take a clean folded washcloth or hand towel, and you're going to lay that right over your bandage. And then you're going to take some of your Press and Seal. And the nice thing about this is it's a little bit thicker and heavier than regular saran wrap, so it's easier to use. With the knees, it's easy. I'm going to lift up here, because you can then wrap all the way around the leg. This product is actually designed to stick to itself And I would then use another strip and go around the leg again. So one more. And seal this up. Okay, and this gives you a nice waterproof seal. For the majority of patients, this will give you a good enough seal on your skin that you probably won't need any additional tape, but you can test it. If you're finding that it's not getting a good enough seal, you can use some additional tape at the bottoms and maybe the top, just being careful that you're not making this too tight to cut off circulation. At that point in time, you're going to go ahead and shower. It's just a quick get in, get clean, get out shower. You're never going to fully submerge this leg, so you're not ever going to get in the hot tub, swimming pool, or bathe. It's just a quick shower. Get in, get clean, get out. After the shower, everything comes off down to that bare incision. So we'll go ahead and remove all of this. You see how well that sticks, so it gives a really good seal. Oops. Almost too well here. Goodness. Okay. Grief. Okay, so again, down to the bare incision, so this existing bandage will come off as well. But all of this comes off. Sorry. Okay, now even if you don't have any wetness to this area, it's still a good idea to let this air out and breathe for a good maybe 5-10 minutes, just to let it fully dry before you replace that bandage. So you will end up changing your bandage after you shower, so that you have a nice clean and dry bandage over that incision. Now we're going to talk about swelling and bruising. Right now you probably don't have a whole lot of swelling or bruising, but just know that when you go home in the next few days, it's very common for that bruising to then surface. Sometimes it takes several days, 3-4 days, so don't be alarmed if even in the next few days all of a sudden your whole leg is bruised. That's totally normal. We've also given you a handout in your total joint notebook that has pictures of normal swelling and bruising. Go ahead and reference that. That's a really great thing to look at when you go home, just to see if you're looking normal or not. If you ever have questions, definitely give us a call and we'd be more than happy to answer questions. But when you go home, one of the things that's really going to help you out is ice. Simple and very effective. The nice thing about ice is most people have ice. I don't care what you use. Ice packs, gel pack, frozen peas, they all work as long as it's cold. You can even make a very inexpensive version of an ice pack or gel pack. We've included that in your handouts, but also I can tell you it's just rubbing alcohol and water. It's 2 parts water, 1 part alcohol, so very simple. Pour that in a Ziploc bag. I would double bag it, freeze it. The nice thing about that alcohol is it never allows that ice to completely get rock hard. So it's a really nice way to ice, because you want to be able to mold that around the area. So especially for knees, you want it up and around the knee. And then for hips, you kind of want to get it up and under the buns a little bit, and you don't want to be sitting on a really hard ice chunk. Also, another alternative of a homemade version, super simple, Caro syrup. The nice thing about Caro syrup, again, take a full bottle, just go ahead and pour all of that into a Ziploc bag, again, double bag it. The nice thing about that Caro syrup is it always stays nice and pliable. It stays nice and squishy. So again, you can really mold it to that area that you want to ice. Couple things that you do want to know and remember when you use ice. First of all, you only want to keep it on there about 30 minutes at a time. So 30 minutes on, and then go ahead and take it off. Give yourself a couple-hour break and then do it again. You definitely want to be icing after you've done any exercise, therapy, walking, or any time that you just feel stiff, sore, swollen. Go ahead and have some ice on there. You really can't overdo. Second of all, the ice really never needs to be directly up against the skin. You always want to make sure that it has some kind of a cloth barrier. Usually your ice pack, gel packs, if they don't come in their own mesh covering, throw it in a pillowcase. That's a great barrier because that ice can still penetrate, but it's still allowing you to get that protection from the ice, but it can still really numb and deaden those top layers of skin, because you kind of want that little bit of a bite from the ice, and that's really helping with pain control as well. So 30 minutes on, an hour or 2 off. Do it many times throughout the day, as often as you can be thinking or doing it. It's really going to help you with that swelling. Also, Elevation. We like to say keep your toes above your nose, so if you can tolerate it, anytime you're laying down, sitting in a chair, go ahead and get that leg propped up on some pillows and ice it. That's also going to help with that swelling and give you better pain control. So when you go home, you can't overdo it. Ice the heck out of your joint. That's really going to help you in the long run for pain control as well as your swelling and your bruising. At this point in time, we're going to talk about your activity, probably the most important part in your recovery process. It's very important that you stay moving. We know that the more weight that you can put on that joint, it's going to stimulate bone growth, meaning that your bone is going to adhere to that new prosthetic, that artificial joint, and by doing that, you will heal faster. You'll have less pain and you'll have less swelling. So it's really important to do all of your exercises twice a day. It's best if you can try and break it up and do one session in the morning and one session in the evening. So try and get yourself into a routine where you get up in the morning, get a little something in your stomach to coat your stomach, take a pain pill. Let that kick in for about 30 minutes and then go ahead and do your series of your exercises. Give yourself a good rest period and some ice, and then fast forward to the evening, you're going to repeat that same protocol. Do some pain medications, let it kick in for about 30 minutes, and do those full set of exercises. The therapists have gone through these exercises with you. Hopefully you have very good understanding. If you don't, let us know. Also, you can refer in your total joint notebook. There's a section in the back with all of the exercises pictured here for you. You can refer to this, or you can call the rehab department directly and they can answer any questions for you. Also, for the knee replacement patients, if your physician has instructed you to use a CPM or a continuous passive movement machine, we like you to use that twice a day. If you can do that 3 times a day, that's great. Usually we say try to do 3 times a day, 2 hours each session. Try not to go more than 2 hours at each session. What happens if you go longer than that, you end up with a little bit more pain, some swelling and stiffness, and it can cause some more discomfort. So don't, in this instance, think, well, if a little bit's good, then a whole lot's better. Try and just limit it to the 2-hour session or as much as you can tolerate. That's also a fabulous time to be icing your knee while you're in that CPM.